35, as promised, 35 different industries, expert from each industry. We talk about the challenges, talk about the opportunities, and the hardship. Well, today we've got a really important and timely guest. We have Dr. Karen Rakers, M.D. Thank you for being with us, helping us how to reopen up safely. Thank you for joining us on Expert35.
Thank you so much for having me. This is great.
Yes, so timely. Before we jump into it, text Expert35 to follow us, to join us. Later on this week, we've got planning. We've got what not to do in social media, what not to believe in social media. Also gold and silver jewelry, and also the how to take care of ourselves, our pets, and how to feed America. So follow us on Expert35. We've got Dr. Karen, Expert46. If you text Expert46, you're going to be able to get some of the PDFs that she's going to link to, some of the information. And then when we're done, we'll put all the notes in the conversation so you can track it. Again, welcome, Karen. Thank you for being with us.
Thank you so much.
Well, let's get right into it. Everybody is kind of worried about, we're reopening. What does it mean? Is it real? Is it not? Well, you're the expert. You're the doctor. How do we reopen safely?
Sure. Well, COVID is real, and it's not going anywhere. So that's kind of the big challenge, I think, for people right now. You know, employers, businesses are needing to bring their people back to work. And so, next level urgent care, we're an urgent care company, but we work with employers in a lot of different ways, including work injury and occupational medicine. And so when things started to reopen, a lot of the employers that we already worked with started reaching out to us to try to help them bring their employees back in a safe manner. And so, we've implemented with several employers things like temperature checks, health screenings, things along those lines so that people can feel comfortable and safe when they come back to their job.
Yes. And how many locations do you guys manage?
So we have 15 urgent care locations across the Houston area. And then we also operate 6 on-site employee health clinics for some big employers in the area, including Fort Bend County and Houston Independent School District.
And obviously having the protocol, building that around it's been super instrumental, keeping us safe and keeping you guys safe, right? We're already blown up. It's like we have questions coming at you left and right. Let me go in here and pick a couple of questions for you. Right?
Sure.
The first question everybody's asking, what if other people don't wear masks?
Yeah, so masks are definitely a hot topic. The big thing in the beginning was N95 masks. Everybody wanted N95 masks. And for the general population, there hasn't been a recommendation for everyone to wear N95 masks. And we really want to reserve those, for our healthcare workers who are taking care of definitely COVID positive patients or highly suspicious COVID positive patients. And so the other part of the question is, regular masks on a day-to-day basis. And I think what everybody needs to remember is that the mask helps protect you from giving COVID to somebody else. So a lot of people talk about this asymptomatic, infection with COVID, which is definitely something that can happen. So people will have COVID, but they have no symptoms, but they could still potentially give it to other people. So those people, it could be anybody. If they wear a mask, they do reduce the risk of, just with talking and maybe coughing or sneezing as they're out in public, spreading that virus out out to other people.
Right. Now here's a really interesting 2-part question. So, what are the challenges your urgent care practice has faced with COVID-19? Let's do that one first, then we'll do the second.
Sure. Yeah. So, we've of course been open since this started, and certainly we had some challenges in the beginning. Everybody heard about sourcing PPE. So sourcing regular masks and N95 masks was a huge issue in the beginning. We're still having issues getting those things, as well as, gowns and face shields. All of that has been a problem. Luckily, we've done okay. We haven't run out of anything, and we've gotten creative in how we use our supplies to make sure that we are well protected in our clinics. Testing supplies was also, a huge concern in the beginning, being able to get our hands on swabs and culture medium and things like that to be able to test people.
The second part of the question is how you adapting. I guess that's part of it. It's you're just figuring out where everything comes from, right? Here's
Right.
another
Yeah.
one.
We got super creative. We were contacting people just constantly the first couple of weeks of this, trying to source, materials. So that was a big deal. One of the big things that we did very quickly was launch a virtual visit platform. So another concern is that, patients were worried about even coming into our clinics because they didn't want to be exposed. We were worried about bringing people with possible COVID into the clinics, knowing that we might have shortages of PPE as well. So we launched a virtual visit platform, which, has done really well. People can be comfortable seeking, medical care and advice without having to be in the clinic setting and possibly exposed to the virus.
Absolutely. And so important, right, to have those pieces in place. Here's another question from Jennifer. What should employees consider when bringing their employees back to work, which is what this whole conversation is about?
Sure. Yeah. So I think, employers are all going to have a little bit of a different scenario. So you really need to think about what your current situation is with your business. Is it a company where you can bring people back and people can be pretty, socially separated during the workday, an office setting where people can kind of be in their own offices or separated from their coworkers? Or is it more of a situation where if you bring everybody back all at once, they're all kind of in the same area, in pretty close contact with each other? And so that's, one thing to consider. If you're in a situation where you can't separate, lots of employers are doing things like kind of a rotating schedule where, some of the employees come one day, another group comes the next day, so that they can maintain that separation in their workplace. Some of the other things I think people need to consider are what kinds of screening tools do you want to use when you bring people back in? So
Right.
Even us, we were in full PPE or at least full N95 masks in our clinics, but we did temperature checks every day on all of our employees coming into our clinics. So a lot of businesses are doing similar things like that. Temperature checks, health screening questionnaires to identify people that either might have some possible exposures or mild symptoms that might trigger them to be excluded from entering the workplace that day. And so that's something we've done with some employers. Also, pulse oximetry, there's been some discussion about, patients who really have no symptoms, except when you check their oxygen levels, they're actually low and it's due to COVID. And so we have some employers that have wanted to include that, in their screening process. So what screening processes does an employer want to use? It might depend, on the type of business that they're trying to reopen. But considering those things is definitely important. Some also want to do COVID testing on all all of their employees coming back, and that is something that depending, we know some oil and gas companies, for example, they're sending people offshore. And in that scenario, they need to make sure that those people don't have, a positive test before they send them out into that setting.
Well, and it's very different, right? If you're exposed to people or not. That's one of the things that we were talking about offline where, well, what happens? So we can open safely, have the protocol, right? All these communication. We'll get a little bit into like the how to do it. But what happens if somebody tests positive in your group? What do you recommend? What, in your expert opinion, what do you recommend on that?
Sure. I mean, if you have an employee that is at your job site and you find out that they test positive at some point for COVID, what the recommendations are is that you're going to figure out from 48 hours, even before the patient was either tested or became symptomatic, you're going to figure out who that person had close contact with. And you're going to reach out to those people because the contacts need to be isolated for a 14-day period so they can be observed for symptoms. And if they were to develop symptoms, of course, you'd want to recommend testing at that point for those
and
people.
Maybe even like record, like restaurants record everybody that's coming in. Hey, that signing sheet that everybody walks by always, like maybe that's a good thing now.
Yeah, if you have the ability to identify if it's a customer-based, business, you'd want to probably try to reach out, especially if it's like a situation where it's more of a prolonged contact.
Right.
If you're handing someone something and walking away, it's not really considered a prolonged exposure, and that's pretty low risk. But if it's someone who's repeatedly, spending several minutes or, longer with an individual and they end up testing positive, that would be concerning.
Right. Well, now let's really get into it. Like, what are the really big things that you're seeing shifting in the healthcare business model? Obviously, everybody's remote, right?
Yeah, I mean, I think really one of the biggest ones, which we already kind of touched on, one of the things that we implemented was this whole concept of virtual medicine. That has been kind of trending anyway. People are wanting telemedicine and virtual visits. But I think the pandemic is kind of going to push that over the edge. And it's, I think, probably going to become more of a mainstream, everybody's doing it, a way of delivering healthcare. So it keeps people, comfortable. They don't feel unsafe entering the clinic. And so I think the issue with that is just going to be figuring out what can we safely treat over virtual and what really needs to come into the clinic for evaluation. And, that kind of depends on what type of illness or chronic disease you're talking about. But there certainly are conditions that can be addressed.
And we were talking this before. We're saying that there's some that you don't need blood tests for. But so this is kind of a timely question for Valerie. What kind of mental health challenges should employers be prepared to face? Because obviously mental health is one that telemedicine has really facilitated, but now we're going to see a new wave, right?
I think, virtual and telemedicine, mental health is one thing that kind of fits very nicely into that platform. You don't need vital signs or testing to assess someone's emotional wellness. You can assess treatment plans and progress without having data that requires you to be with the patient in the room with you. And so that, I think, is going to take off as well. Mental health and emotional wellness is definitely an issue right now. Everybody's talking about it. There's been so much fear and anxiety relating to this pandemic, and people are dealing with, isolation. They're home. They don't have access to, their usual social networks. People are having financial issues. They're fearful of becoming sick themselves. They're fearful of spreading illness to their loved ones. Some people are having stress of working from home. Sometimes their kids are home with them. They're trying to homeschool, virtual school as well. Lots of stressful things going on. And some people are even, having physical violence in their home, domestic violence and things like that. Times like this sort of escalate a lot of that.
Well, and that's the foundation behind Expert35. We noticed that everybody's now wearing 35 hats, right? And just having the sports guy on Friday just made me realize just how much I miss sports and that release we used to get from that in the community we used to have when we were playing with our children or our neighbor's kid or whatever. And that community is now separated, and you don't have your job community, you have your work friends, you don't have your all these little things that were making other things less noticeable. And now that's really affecting us in a much deeper sense. This is a question that I think only you should answer, right? Is Texas opening up too soon?
This is such a hard question. I think, you and I were talking offline before this. Part of the problem is that we just don't have good data about what this virus is going to do. We don't really know how many people are currently infected, have been infected already, whether there's immunity to previous infection. It would be great if, early on we had been able to just mass test everybody and, had a better sense about what was going on. I think the bottom line, we do need to open. I think, my personal thought is I think the stepwise fashion is a good way to try to do it. And I personally hope that, some really smart public health officials, epidemiologists who are trained to kind of watch data and understand trends are paying close attention to what happens with numbers and, hospitalizations and all of those things. And so that each step that we take to reopen if we see that there's a big negative, outcome, that we can maybe take a step backward. So,
well, and the data is a couple weeks out, right? So we're always kind of lagging, right? And Corona's not going away. So I think we should kind of remind people, like, we're taking these steps because there are enough beds in the hospital, not because it's safe, right?
COVID is still there. So, yeah, and I think that's part of the reason, employers, if they do this in a well thought out, well communicated, safe way, I think you can bring your employees back, but you just need to be cautious and make sure that everybody's on board with the plan that you set forward to, keep people from spreading illness in the workplace. Which
goes to my favorite part of the show. 3 things to do now. So 3 things to reopen out safely, and Sure. What are those 3? Go.
So I would say definitely for employers, as you're thinking about what you're going to do to bring your employees back, I would recommend forming a task force that represents your employee group so that everyone feels like they're well represented in the decisions that are being made, and get input, figure out what people are concerned about, look at the guidelines, CDC, places like that, where you can get good guidelines on testing and, wearing masks, things of that nature. So form a task force, make sure that you are communicating very well with your employees. Even for us, we have had to really ramp up our communications to keep people on the same page and, up to date with information. So frequent, but very focused, clear communication is key. And then I think last, for employers especially, is to pay attention to the emotional wellness of your employees. They might need some extra support at this time. So, if you have things available already, EAP programs and things like that, make sure that they know that those are available to them.
So great advice. So great having you on the show. Thank you for joining us, Dr. Karen.
Yes.
Now I'll give you a little bit of a chance to talk a little bit about what you guys do here. I'm going to put up on the screen your facility. I got your screen on there. So tell us a little bit more, like how you are helping get back to open safely.
Sure. So, again, Next Level is a urgent care company. We're all over the Houston area. We have 15 locations, but we also operate on-site employee health clinics for several big organizations. And we do occupational medicine and work injury care for other large employers in the area. So for several of our employers that we work with, we are doing temperature checks. We're doing COVID-19 testing. We offer subscription plans for employers as well, kind of near site services. So if you kind of are a medium to smaller business looking for, more affordable healthcare options, we can give you access to all of our urgent care locations for low monthly fees. So just keep us in mind.
So great having you on the show. Thank you for being with us. Expert36, Dr. Karen Rakers, thank you for being with us. So timely, so important to hear about how to reopen safely, and that there are protocols that you could follow. We're going to put all those notes and all those resources inside of the chat. But again, if you want to follow her, if you want to get access to that resource, text Expert46 to the number on the screen. And again, thank you so much for being with us today.
Excellent. Thank you so much. I hope everybody stays safe and healthy.
All right. Thank you. We'll see you soon. All right, guys, follow us on Expert35. We've got planning. We've got gold and silver, things not to do on social media, and listening to your pets and how to feed America. So follow us on Expert35. Thank you for joining us. I'll leave you guys with her graphic. Thank you. See you guys soon.
We educate during difficult times. We collaborate at Expert35. This is for a better tomorrow and a better today. Let's come together, and together we will find a way. You got questions, we got solutions. You got problems, we got resolutions. Visit Expert35.com.